This demonstration serves as a visual guide for new nursing students to learn the correct locations on the chest wall to place the stethoscope during a cardiac exam. Nurse Carter will demonstrate a method of finding these locations using anatomical landmarks on the chest wall that correspond to locations of the heart valves. Mr. Williams is our patient today.
Hey, Mr. Williams, how you doing?
I'm doing fine. How are you?
I'm good. I'm going to be listening to your heart today with my stethoscope.
Sounds great.
Sometimes it is good to warm the stethoscope in your palms before placing on the patient's chest. There are bony prominences on the chest wall that we can locate by visualization and palpation. The right and left clavicle, the sternal notch, the sternum, the manubrio-sternal angle, also known as the angle of Lewis, actually a palpable groove in line with the second rib. This groove is found by palpating down from the sternal notch. The intercostal spaces, or spaces between the ribs. To begin, locate the right clavicle. Always remember, when right or left side is referred to anatomically, we are referring to the patient's right or left side. Palpate the right clavicle with your fingertips. Now just below is the first rib. Feel the lower space below. This is the intercostal space. Palpate the second rib and check the manubrio-sternal angle. They should coincide. Now, locating the right second intercostal space, move to the border of the sternum. This is the location of the aortic valve. Listen with the stethoscope. We are hearing the sound of the aortic valve closing. Blood has been pumped out of the left ventricle to the body. Move across to the left sternal border, second intercostal space, and listen with the stethoscope. We are hearing the sound of the pulmonic valve closing. The blood has been pumped out of the right ventricle to the lungs. We normally will hear one sound, S2. Now move down to the third intercostal space, left sternal border, also known as Erb's point. This point is of interest because this location is roughly halfway between the valves at the top part of the heart, or the base, and the valves inside the heart, which are at the bottom, or apex. These are the atrioventricular valves, tricuspid and mitral. Move down to the fourth intercostal space. Listen. This is the location of the tricuspid valve, which separates the right atrium and right ventricle. Now moving down to the fifth intercostal space, visualize the left clavicle and move to the center. In a line from the middle of the left clavicle, drawn perpendicular with the nipple line, where this line intersects with the fifth intercostal space. This is the location of the mitral valve. The sounds made by the tricuspid and mitral valve are known as S1. S1, or the sound of the tricuspid and mitral valves closing, occurs after the top chambers or atria of the heart empty into the lower chambers or ventricles. With the normal heart, we should only hear these two sounds, S1 and S2, or sometimes referred to as Lub Dub. Thank you, Nurse Carter. Thank you, Mr. Williams.